Donna Kelly. I'm the Director of Occupational Therapy at Children's Specialized Hospital in New Brunswick, New Jersey. And we are the largest pediatric rehab facility in the nation. Right now we have a 60-bed inpatient facility. We've been around since about 110 years, and we started off just doing patients with polio, and then when polio was kind of cured, or in a way, in a sense, with the vaccination and everything, that we switched over to cerebral palsy and other disabilities, and that's how we are today. We also expanded our services. We have 5 outpatient sites throughout New Jersey, including New Brunswick, Toms River, Hamilton, Mountainside, and they all provide outpatient services. We also have 2 long-term care facilities, a medical daycare, and a preschool disabled classrooms. So that pretty much sums up all of the services that we provide. As far as the listening program, we've used it ever since it began, really, in 1999. So we've had several providers trained. We did a big training 2 years ago, and we have now over 40 providers that have been trained in the occupational therapy department alone. And this year we just hosted another training, so we did all our new staff, as well as including the speech therapy department, which is really exciting that we'll have that combination of both occupational therapists and speech therapists during the listening program. And how we use it on outpatient is we use it during therapy, we use it in sessions, and then we also do the home programs, which is great. And we just got our new bone conduction systems for each site, so we're starting the bone conduction units. And also on inpatient, we've just begun to really work with 2 major teams. We have 4 teams on inpatient. We have general rehab, spinal cord, brain injury, and infant toddler. So the major 2 teams that we're trying out TLP are brain injury population and infant toddler population. With the infant toddler population, we've been using the Music for Babies and creating mini surround sound crib setups with 2 little speakers at the top of the bed, and then holding the CD player at the back of the crib. And we've been playing Peaceful Baby and Sleepy Baby to see if we could reduce the heart rate and respiration rate, and it's worked out very nicely. In fact, some of the nurses really were asking for the CDs to be played because they calm the babies really nicely. So that's only like the beginning. We're just really starting off with TLP and infant toddler, so we're hoping to really expand that program and take some documentation and data. And for brain injury, again, it's a new program for us for brain injury, but so they have similar issues of attention, perceptual difficulties, motor coordination. So we're really trying to see what effect TLP has on that population as well. And also just starting to work with some of the children that are more in the coma stim level to give them a really good internal stimulation through music and through sound that normally we couldn't do with our regular sensory stimulation program that we have at Children's Specialized Hospital. So we're just beginning to set up a program and protocols for brain injury, which is really, really exciting. And we're going to be working with our physician as well. He's very much on board with the listening program, and speech therapy and occupational therapy are really leading the way in that direction in this field for the brain injury population. So that's what we are doing on an inpatient level and pretty much on an outpatient level. We'd also like eventually to get some surround sound systems, because some of the children with brain injury go through transitions of overexcitement and aggression, and need some kind of intervention that maybe not tolerating headphones. So that would be another thing that we're hoping to design within some of our rooms, to have like more of a breakout room with surround sound to see what music can affect the like behavioral issues and behavioral things as they're transitioning through their brain injury and healing. And I think that's about what we're doing for inpatient.